And so I call this meeting to order. Let's do the Pledge of Allegiance, and let's see if Mr. Washington can start this off.
Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. Okay, Dr. Brown, would you give the roll call? And it's only necessary for the board members and attorney and you.
Jay Prince.
I'm here.
Tom Flower. Present. Bill Kenda.
Here.
And myself here. Cliff Brown.
And then in the room also is our attorney, Clint Smith,
Present.
OEM, Adrian Washington. And then we've got Vernon running the hardware for now. Okay, let's see, it takes care of this. We won't introduce anybody online unless they come on with a comment. So agenda wise, I think we've got it pretty much down here. I know we had some things that Tom, you brought up that we might speak to, but I don't think it's an agenda item, but let's see what we've got. Jay, you have any amendment items?
I have no amendments.
Tom?
No.
Okay, I do not either. And the minutes, we did have a set of minutes and they looked pretty concise. So I'll leave it open for comments. Jay, if you got anything to add?
No, I thought they were good.
Tom?
No, good.
Okay, looks good. I may have a motion to approve.
So moved.
I'll second it. It's been moved and seconded to approve the minutes from our last board meeting. All in favor? Jay?
Aye.
Tom?
Aye.
Kanda, aye. Okay, report wise, this Board of Health wise, let's see if there's anything that you got to add today, Jay.
I don't really have anything to add. I'm just a little distressed that our numbers are rising the way they are, but
We'll talk to that.
that's the world really,
Right.
of which we are a microcosm of that.
Tom, you got any report?
Yeah, I had some things I wanted to bring up. I guess it's for us, maybe directed towards Dr. Brown as well. Had a kind of an interesting conversation with one of the county employees
Yeah.
concerning that person testing positive. I asked her how the contact tracing went. And she said, "What do you mean?" I said, "Who did the contact tracing for you?" She said, "I called Dr. Brown and let him know my status of being tested positive. And that's the only communication I've had connected to COVID." And I thought, what? I said, "You're telling me that nobody has called you to do the contact tracing to find out who you were in contact with?" She said, "Absolutely no one." She said, "I did tell Dr. Brown who I was around on Thanksgiving, and that was it." And I just was floored. I sat in my pickup and I went, come on.
In theory, it should be being done by the state, right? That's the
Well,
agreement we've got.
no, it isn't
Whoever
really.
else.
It was at one time, right?
Yeah.
Up until last week.
Well, maybe that's part of it. So you want him to
Well, I'm not
describe the
saying
process?
this accusatorily. I'm just saying I can't believe that either we or the state did not do any contact tracing on this person.
Do we know that?
Yeah.
Because she didn't know, does that mean that she hasn't been interviewed or?
Well, I interviewed her, but that should have also had a legitimate contact tracing taken care of by the people who are doing those
Right.
things. You know, our county.
So who's doing it?
Well, there are several people that Cindy Flower has kind of made sure that they had their training, and she generally assigns a person to do that particular tracing. So that is no longer with me or with the state. It is now taken care of by that particular chain.
So
Who made
the
that?
state will not do any contact tracing, or they will?
They have withdrawn
overwhelmed,
from
or-
doing it because we were assured that all of these things are being done here now, because it's now no longer in the domain essentially of the public health that has been kind of transferred over to the people who have gone through the testing, through the training to do the investigative
So,
contact.
so is that a county function now that they're doing, or is it a different agency? Who's Cindy doing it for?
She was doing it for us.
I know, but who's she doing it under the auspices of?
Essentially, since they've been trained, it's under our,
So it's a county function,
our public health.
but not part of the public health department, you're saying?
Not directly.
Are those strictly MRC people
They are.
that are being trained to do
Yes, sir.
contact tracing?
No. That's not entirely an accurate response, because we are trying to get our actual public health people, at least some of them there, and I need to go through it also. I'm sorry, I haven't had the time to go through that.
Well, but you can't do everything.
No, but I just want to know what they have been trained to do, so I have expectations.
So Cindy's been working from home. She hasn't been going to the office.
Right.
So I overheard her say, I assume it was to an MRC person about Dr. Justina program. Now,
That's
that's
what
a
it is.
program. That's not a person, correct?
That's right.
Okay. And so is that part of the contact
That
tracing?
is the program under which, those are all the forms they're filling out, asking all the questions and being able to input directly into Cedars.
Okay.
So let me ask a question, Tom, to you. Do you get the sense that this is a one of a kind miss because it got transitioned? Or we
I have no
we have a
idea.
problem?
See, when she told me this, I thought the state was doing her contact tracing.
It was.
That's what I expected her to say. I said, did someone who from the state called you or did they do the contact? She said, no, I haven't talked to anybody. And then I thought, well, that is really weird
Yeah, it
not to talk to have
Well,
talked.
did the state want to relieve themselves of the burden? Is that what they wanted
Yes,
to do? Okay.
essentially, they did relieve themselves of the burden without telling us.
Okay.
Yeah.
So I went through all of that this last week, trying to get everything straightened out. So supposedly, and they kind of caught us up, but then Cindy took over and says.
So how do you feel now? Is it under control or not?
I think it is. I've asked questions about individual names, but she actually has access to all of the names through this Dr. Justina program. And so she is assigning them out from
Okay.
what she has told me.
Do you know, I don't want to get into names, you know who I'm referring to as the,
Yes.
as the
Yes, sir.
affected person. I guess my concern was that without that, I mean, I think that person notified all the people that was directly in contact, but that doesn't mean there couldn't be extraneous people. We'll never know about that, right?
And most of the people that we investigate, we don't know, because they don't, I mean, this is all memory from.
Right, sure. As
Whatever.
accurate as they can.
But I did ask her, for any contacts who, whether she had people living with her that we had to quarantine, we quarantined her son. And who she'd been in contact with here, which led me then to start to contact the social services department and let them work from there. And they came up within a couple
That's
of
okay.
hours.
So it sounds like you did the right thing. We got a track in the sand going with who they were in contact with. We just didn't get any
Formal
further.
from the state or
Okay.
from
Right.
the MRC, yes.
Okay, so then,
Exactly.
okay, so I guess that would be the next question is to you can let us know what
Yes, sir.
later how that's playing out, whether it's formalized now or not, or should be.
It should be, but I will
Right.
find out.
So do you know if this person ever showed up in Cedars?
She has not, nor has the other person in that same situation
So,
shown up.
But we've had several of those.
But they have, and that's one of the things I want to talk to you guys about, because when testing is done elsewhere, I don't know if it's being entered improperly into Cedars, saying that they are a member of this county, wherever the hospital was that did the testing. That's my suspicion, but I haven't been able to get any word back from the state that would tell me
See,
Absolutely,
that got us in the jam a week ago,
exactly,
because Sears was lagging or ahead, one of the.
exactly. And that other person has never shown up and it's been a week.
Right. And so then Cindy nor any of those MRC people would know to even do that contact tracing, huh? I'm assuming.
Except that I told her.
Oh, okay.
This person was
So
there.
they don't get all their information
From
from
Sears.
Sears.
Not when they
Okay.
don't report it.
Well, so what it really means is you need a process that ensures we're covered. You're going to get a database of Cedars, you got a database of actual reports to the public health agency. You can marry them up and
And
make sure we're doing it.
only because this person directly phoned me did I even have a clue, because it's not there sitting in the
Right.
database.
Right.
So
Yeah,
like I
which I
told you
just
guys
thought was
before, it's
bizarre.
not.
Yeah. So anyway,
Okay,
thought that was very bizarre. I'd also made a note to ask about this vaccine briefing, but I'm assuming you're going to speak to that. So if you are, I'll wait. And then I had another question. Is there any law governing that, not law, but because we know that, about refusing, if you call me and say, I want to do contact tracing for me, and I say, well, I'm not giving you any information. Then where do we stand?
Not that I know of, because I had one gentleman who phoned me and said, I'm going to tell you that I just tested positive, and I'm also going to tell you I'm not going to isolate and I'm not going to quarantine. And he wouldn't talk to me after that. I mean, he literally would not even allow me to say anything.
why would he bother to tell you it's positive?
He
That's
said, I'm
crazy.
doing my civic duty.
That doesn't help at all. Unless his civic duty means he's staying away from people.
It's kind of like military intelligence.
Okay.
Do you know this person's name? I'm not asking about the phone number.
Yes, I do. I have it written down in his
Okay,
phone
so-
number.
Go ahead.
In the, for public safety reasons only, maybe a conversation with Clint to see if it's still a HIPAA violation if you disclose that.
That's right.
So you
And I'm
can't
not-
tell us.
Hang on a second. If maybe it's not a HIPAA violation, that the health and safety of the people in the county might override that, where you could say, if you've been in contact with Mr., you said it was a man, Mr. Whatever, please go get yourself tested. Even though he chose to tell you, he got his name. So I wonder, HIPAA is not the end all and be all. It's not an absolute. If public safety can override that. So maybe I would suggest having a conversation with Clint to see if,
Yes, sir.
it's just a suggestion. I don't know the answer.
Well, the other suggestion I would have would be, you could personally call him back. How long ago did you call him?
That was last week.
So you could simply to ask, just because you did your civic duty, and I'm following up with your civic duty to see if he's been keeping away from people, or whether he's got people he could let you know.
They said he
Just
wasn't
have a conversation.
isolating, is what Dr. Brown.
Yeah, that's right. He said he wouldn't, but he may have had a second. But in other words, a follow-up in a positive sense makes it not, he's not reporting to Big Brother here or anything to me.
Yeah,
And get Clint involved.
that's what I thought. I mean, I believe there's a certain number of people who would elect not to share
Sure.
that information. And if that's the case, do we have any recourse for that or not? And then finally, this came up during our BOCC meeting this morning.
That was the
I
one.
wanted to ask Cliff how many new hires you have in public health since you started. The rumor mill's out of
There's
control.
volunteers and there's hiring.
Right.
Just want to ask about new hires, people you've actually hired.
We have 4 that I can think of right off the top of my
Okay,
head.
Sherry being one of
Yeah,
those, right?
Sherry,
Okay,
Sherry is
so,
the one permanent, full-time. The
Okay.
others are just pieces of a day.
And they're getting piece a day wages.
Oh, yeah.
Yeah.
Yeah, there are no benefits. assumed with any of these positions or any of these things.
And
Yes, sir.
those were all budgeted stuff or?
Yes, sir.
So if I'm hoping by summer, maybe the coronavirus will be way down and we may not need these folks.
That's right. These are
Just
all
a temporary basis.
temporary, just to
Right, that was kind
That
of
was
Try to
that
mitigate.
was the reason.
the overwhelming,
excellent. Thank you.
like we have to be able to keep up our immunization schedule. So, and Beth is doing a beautiful job training Sherry, as we all agreed that she would.
Right.
But the others are literally answering phones, trying to make appointments, just to take
Right.
some of that heat off.
Okay,
I'm not questioning having those folks on. The question was this morning, if there were more than just Sherry being full-time.
Right.
And we geared up just for COVID and COVID wanes, or we can have an excess number of employees. Is that it? You answered the question.
Okay.
I was just explaining why we were where we
Yes, sir.
why the
That's all I
question
have, sir.
okay, I have a question too.
Yes, sir.
Life goes on, there's more than COVID. I've had people asking me about shingles shots. I've had people asking me if there's any other issues. Where's the flu? What's the flu been doing to us? And are there flu shots going on? So,
This is just off the top of my head, for the amount or the number of actual people phoning with the flu, it's a handful. And I'm basing that on the fact that they did not test positive for COVID, but they had the influenza type of symptoms, the aching, the tiredness,
Right.
so.
right, and so I've had another sort of a complaint. People have other symptoms, bronchitis. This time of the year, chronic bronchitis, and they actually went to the clinic, several of them have, and they wouldn't see them without a test. And so how do we handle, attending to somebody that has a condition that needs some attention and then have to wait for 14 days or not get a report? And they've actually done that. They've waited 14 days, and then, so are you getting any feedback on any of that? And can we work with the clinic? How do we handle it so they feel comfortable that they can see these people?
Yeah. Besides the fact that I have no way to force a private
Right.
clinic to do anything, basically they are doing essentially what all, quote unquote, all the rest of the doctor's offices are doing. We will not see you unless when you have any kind of symptoms that might possibly be COVID related. So my prayer is that very quickly we'll get one of these quick test kit type of things available to
Yeah.
us so that we can test them that day, have an answer that day, and be able to say yay or nay. Go in.
So I was hoping maybe there's also an opportunity because you have a bunch of resources. And as long as they're not showing all the other symptoms that would be described, it seems like they ought to get some comfort knowing, and with some people understanding, where do you draw the line?
And that's the problem, is that there is such a wide variety of expression
Okay,
of this particular disease that the clinic, I mean, they may be close to God, but they're not God yet.
well, nobody is.
Nobody is to be able to differentiate ourselves.
Okay,
But we do not give out, like we're giving out shingles vaccinations routinely. We're giving out the MMR, the measles and so on, and other vaccines for flu. We're doing that routinely.
people are getting
We
these
have
shots.
been for, we're going on 3 months now.
I got both of them.
all right. Okay, well,
Shingles and
Tom, it's your opportunity to build up to the big one with more vaccinations.
Yeah.
Go in for a flu shot. All right, so that takes care of that. Then Dr. Brown, if you want to just bring us up to speed on the status, and then
Okay.
before you do that, just so we understand, we're not going to get involved in a big discussion. We just need to understand where things
Gotcha.
are, the issues there in work. And then I've already gotten word Jackie is not going to be here. There's no sanitarian issues for us, even though she's got a standing position on the agenda. So go ahead.
She actually asked me if I would say that she has nothing to say.
Okay.
The present total positive cases in the last 7 days is 31. Now realize that is not going to show that in Cedars because it doesn't count those 2 people I mentioned to you. Okay, but they're still, that's the way it is. And probably, like I said before, this is because they've been tested elsewhere, so they're not showing up assigned to us at this time.
So it's really 33 then.
No, it's really 31. They actually say 29.
Oh, okay, gotcha.
Okay, so I just added that in, so if somebody hits you.
That's our count, then,
That's,
That's why it's different when people ask us,
Right.
and the state has a different number.
right.
I understand that. I try to explain it to
Okay,
them.
thank you. That saves the additional phone calls for more. Total tests this year as of last evening were 1,290. That's COVID tests. In our local medical clinic, 26 tests were performed since the 2nd of December, 11 since the 25th of November. Actually, we have more than that, where it's up to 41 now. 41 tested since the 25th of November. There were 10 positives at that time from that testing, and there are 34 that have been tested since the 1st of December. The active positive number percentage for the past 7 days is 18.5. Remember the orange sector as assigned levels of color, coding and so on for restrictions is 18.5 as of this morning. Between 10 and 15 is orange. I just want you to know. Due to exposure, that's a day thing. So remember I told you I wanted until the end of this week so I could see if it starts to taper down, because these are tests that were done essentially secondary to Thanksgiving. Okay, so if it goes up between now and the end of the week, then we're going to have a talk. We'll have to make our considerations. I spent about an hour on the phone last night with the person who assigns variances from the state to the county, and explained essentially the situation to her, the variables that we're going through, and she is in concurrence. And I want to broach the subject a little bit later because there's some other factors that are in here for state funding. Due to exposure by a food service worker in the school, the schools are now quarantined as of today.
What grades?
The schools. Because it's
12 or-
food service.
we got an email from McFalls during our meeting, and he said they shut it down because they've had too many staffs on quarantine, so they shut it down through Christmas.
K through 12?
Yes, sir. Yeah, because food services, bless you, food services, bless you again,
Wow.
for everybody. So that really affected us.
Well, that's why Jordan had to leave and go pick up his son.
So lots of families will be affected there.
I didn't see an email from the falls.
Where's your server doing? It came,
I got one.
it's really strange.
Okay, the next kind of item on my suggestion agenda is vaccine distribution, because that's a common question.
Wait a minute.
Okay, I'm sorry, go ahead.
I was going to ask, where does this bring the total from the time we started? Have we reached 100 yet? I know we're close.
We are, let's see, I wrote that down here too.
December 2nd.
It's like 80.
No, we're 99, and now we're, because of the extra 2, 101.
101.
And
Thank
that's
you.
not Dalmatians.
Here, I got it.
And how many hospitalizations do we have? at this point?
1144.
We have
One.
Remainder this week. remote.
Well, I'm just waiting for him to read what Magnet Falls.
Putting in for a Cora violation, you're talking without me?
Yeah,
It's not core.
I wasn't talking, I was reading.
Sunshine law.
Okay.
That's what I meant.
You want the email? You want my email
I
too?
was
Yeah.
teasing with you. I meant sunshine. I was kidding.
And that was effective as of today, so they're not in schools today.
That's right, they're the parents.
They left at noon.
That's terrible.
Yeah, and we'd had, I don't know if you guys got it, I don't remember seeing copies and
Of
who all
what?
this was sent to by one of the teachers saying, please don't shut the schools down.
Yeah, we all.
Oh, they're all
got that. You know,
We have
and
to,
maybe I'm gonna get hate mail and despised more for this, but I'm sorry, but the kids' safety, in my opinion, overrides. I mean, and if the child has to graduate high school at 19 instead of 18 or 18 instead of 17, look, nobody invented this. It's just the way it is, but health and safety come first, in my opinion.
yes, sir. Well, that's what Mike McFalls understands and the school nurse understands, and that's what we had a conversation about.
I agree.
But you're not the only one who get the hate mail, I promise.
You get killed for those kind of comments.
Interesting. Wow.
So the vaccine distribution, are you guys ready to go on to that?
Well, let's talk, okay, so now in the new business area, so the current status, if there's any other discuss, all that was, I was trying to keep it segregated. You get a report X, Y, and Z. Is there any other discussion on the current status with the state?
If I may, before we move on to that, I recognize you want to wait till the end of the week to see if this trend is continuing up, leveling off, going down. 31 in 7 days, even though I recognize, that might just be an anomaly and it's going to come back down. In a community our size, this is very distressing to me. At what point, and this may not even be a fair question because you may not have an answer, but at what point are you going to say to us, guys, we need to move on to code red?
On Friday, because I asked for 2 weeks.
Okay.
If today, because we had all of these positives from yesterday, if today stimulates more or less, that's going to be part of it. If tomorrow does the same thing, and if Friday does the same thing, because I told you 2 weeks, it'll be 2 weeks. So we will have to have another conversation on Friday, and then we will collectively, I believe, but you guys make the decision, decide where we're going. Okay, just from the numbers.
So if I may,
Finish it.
Bill, would you like to host a meeting for Friday? Maybe
I'll post a standing meeting. No, that's okay. It's not a bad thing. Or we can call it as an emergency, but I'd rather post it. So,
I mean, I'm just suggesting if Dr. Brown's going to wait till Friday,
yeah,
but we already have the
there's no reason why we
coronavirus
wouldn't.
relief
And
fund
I would rather post it.
at 1:30. So it's just a suggestion. Maybe we want to have one at 11 or 10 or something.
Yeah, somebody look
Get
at
an
it.
hour or two, and it may be very brief. And maybe Dr.
What do we have,
Brown, it's great. Move on.
CVRF, I'm available Friday morning.
Yeah, Friday,
Available.
probably around, I'll look at doing it at 11.
11.
So, Tom's got another question, and then I have a point to make as well, a question for him.
Thank you, sir. So as far as you know, how many county employees are currently infected? Okay.
3, just so the public,
I'm sorry.
they can't see it and hear it.
Okay.
Those are positive in isolation cases. For the county.
Yeah, I came up with a different number. I just want to run this by you as mundane as I can. So we had a mother and son.
Yeah, but the son is not the county employee, so that's why.
There is.
Okay.
But he's down to 2.
We have one hospitalized county employee.
Yes,
That's 3.
Okay.
Two
Mother
out
and
of,
son, her son is not a county employee, he's in school.
Oh,
oh,
okay, that's a
okay, we're
different,
talking,
yeah,
we're
different.
talking different,
Different people.
okay. I think we have 5 myself, but, so 2 out of human services,
Right,
road and bridge,
that's one. Okay, so that's a total of 3.
3, and then, yeah, and then 1 more. There is, I can't say this unequivocally because I don't know. I haven't seen it. I'm only going on what I was told, that one of the county employees' son, who works for the county, also tested positive.
Oh, okay.
Will you just jot down a name and hand it to him real quick? And I will. I'm sorry. We just had this conversation this morning about trying to honor the HIPAA laws as best as
Yes.
we can.
Put where he works, that'll help him.
I did not.
You're talking about this?
Yes.
Okay,
You know where he works?
no, I didn't
Okay.
know that he was an employee.
Okay.
I thought we had,
I know
it's been
his
some
name.
time ago.
Yeah, I know his name from last week.
Right. Oh, yeah.
Okay.
Sorry. So,
Okay, I stand corrected.
yeah, that's okay. I just,
So the reason you're asking is,
well, I wanted to find out what I don't want to call it a trend because it's not, but what the data says about our county employees' infection rate. So we're 4 or 5 out of 81.
Out of 100, well, yeah, okay.
I think we have 81 or 87 employees.
employees are 80.
Oh, I see.
I thought it was 83.
Well, yeah, it was 80. Hell, who knows day to day, right?
Yeah.
We're down 1 for sure, so, yeah, okay. I also look at that as an indicator, as a community within a community.
Yeah, just to see how, it's like, where is the hotbed?
So points
That's
7.8 for the community versus 0.6 to 0.7 for the.
all right. Thank you. I was just getting ready to do the math. Thanks.
Let me, you done, Tom? You got another one?
No, thank you. That was it.
In response, if I may, I did instruct, because now that you bring this up, I did instruct all of the other employees in that particular section to make sure that they're wearing these things when they're at work.
Okay. Then, if I may, sir, then what about testing? Or what's your recommendations about other people getting tested if they've been around a positive?
It was being advocated 5 days. Now it's being advocated, from the latest that I saw of the state, 7 days.
7 days.
So to make sure that the person really has had a chance to develop what they're going to show.
Right.
So you're not testing too soon, otherwise it's
Right,
a
otherwise
false
it'll be negative.
positive or negative, I
False
should say.
negative. Right.
Okay.
When do you become contagious? I mean, you know what I'm saying? If we wait 7 days
Right.
to take your test, are you exposing people for 5 of those 7 days?
Right.
And you very well could be. That's why I said they had to have the mask on to show up for work.
And I guess they're truly answered technically his question, is it 2 days prior to when they show symptoms, or is it,
It can be as much, well, they may never show symptoms.
well, if they
But
did show
if they show,
symptoms?
it's several days, and it could be
From
3 or
prior.
4,
Okay,
5.
Yeah, that's,
So there's just no nailed down
right.
number.
Okay, another question, anybody? I want to make a comment also. The problem I see right now, and I need you to have your resources, experts, and when you come to us on Friday to help us, because the percent positives in this county are based on 1,290 tests. And the most recent tests are, it appears that we're pooling a pool of people that have already been exposed and are, probably a pool of positive people. If you kept that up, we would continue to grow the number on top of what we're dividing here. The 31 would become 40, and the test becomes 1,210. So it's skewing the actual percent positive, our positivity rate. We need to figure out how to normalize that because our population, the rest of the population, there's a lot of people that aren't in that pool where they're getting exposed, and they are probably negative. We don't know, but the science says, let's go take it times. In this case, are we using 4 times or are we using 5? The population of the county is 5,000 maybe, I don't know. So when we get talking about it, we need to look at the whole picture so that we're not making a decision on some data that may not be complete or it doesn't represent the total population.
So you think the people getting tested are skewed because you're getting tested because you are a potential
Right.
positive, as opposed to a relatively healthy person who is not going to get tested.
That's right. And you don't know that. You see, we really never really know unless you test all the people in the county what the real
And that's right.
positivity rate is. If you can do it instantaneously.
1,200 or 1,300 is not a random sample.
That's right.
However,
It's really tough.
It's all we have to go
Well,
on.
that's
We
the
can't
thing.
make up the rest of it.
Right, except that we have to look at other things that they look
Other
at. Like there's,
considerations.
And that's
what I need to know more, say, so we can
And
extrapolate.
Bill, your point is really well taken. The percentage positive to me is less important than the number of cases
Yeah,
over the last whatever period, whether we're doing it by a week or a month or whatever. So when I see a trend, and I'm not saying it's a trend, when I see a number like 31 in
Yeah.
7 days, even though I recognize that it's not probably a true, accurate 7-day forecast, we'll learn at the end of this week.
Yeah.
That's much more viable to
Right.
me than the percentage, because you're right. I'm not going to, if I'm healthy, wealthy, and wise, I'm not going to get tested.
and he's got guys that have come from bigger population areas and smaller ones too, that can give us some reasonable statistics. And we need to get it so we can apply it to our case. We're unique because we're small, it's a large area, yet we concentrate our population here. So, some big number is right here. That's why this contact tracing is a good thing to kind of know where is it all occurring. It's not, where is it predominating, predominantly. So if you can come get your experts together for me, that's all I'm asking.
So far in the contact tracing, I have not been able to identify a hub,
Right.
a central infection point.
Yeah.
I checked with the Bureau of Prisons, that reporting, and the people that are here that are positive now, not in the past, but now, are not
Right.
employees or in contact with the Bureau
And
of
this is
Prisons.
just an aside. I've had a conversation with Adrian, and Adrian's done a little statistical analysis based on the prison populations reporting what they got. And it seemed to correlate with our spikes with their spikes. So I don't know if that's true or
But
not.
so are all the other
I would
counties.
say, and the state.
Yeah.
I mean, we're all
And
Yeah.
the
doing that,
country,
so.
yes.
Yeah, where is it now?
Yeah.
Okay,
So I have not been able to narrow it down there or to a specific church or specific banquet or
or a
anything.
restaurant
Or a
or
restaurant, no.
or a
We're
hardware
not-
store.
we are not getting what I expected to have. That
Okay.
was from the penal system or from restaurants that say,
Okay.
well, we haven't done this and this. It's just not there. We haven't been able to
All right.
trace it back.
All right, well, any other questions along that? All right, now give us a glimmer of hope. When are we going to get vaccinated?
The light at the end of the tunnel is not necessarily the train.
Okay,
So our glimmer of hope for vaccination is just a glimmer, because right now, the first people who are going to get the vaccines are going to be military. I mean, that goes without saying, but I still had to say it. The second level, and they just this morning kind of identified a breakdown between the first people to get the vaccine into 2 parts. So it's still being divided down. And they are putting the people who are really high risk, those who are working full-time in COVID emergency rooms, this type of thing.
okay, now stop. Very high risk population. Who determines that for us? Is that you? Is that,
No, that is the state.
well, meaning 90 and older with
Oh, no.
pneumonia? What
No,
does it mean?
I'll get to that.
That's okay.
Those people are high risk here but they are now in the secondary columns in the state's distribution
that's
system, okay? So they're not even covering all the primary providers. They're covering the people who are most like EMS,
Okay.
hauling somebody in who's, definitely
All right.
definitely sick. So it's that level, that's 1A, then 1B.
EMS is 1A.
Yeah, then what, and 1B becomes the search and rescue and our general physicians and primary, like nurse care practitioners and so on. And the people who are doing the vaccines, actually injecting.
Okay.
Okay. So, and in that secondary category, then you end up with the people who are in extended care facilities, nursing homes.
That's the next high risk. Okay.
Yeah, so that's the 1B. And then you start to go down into essential workers and, people that have to take care of the roads and so on. So for
So,
the general population, do we expect that it will be before summer? Probably not.
before you get into that, so theoretically, the state's gonna give us a list of these things, and then they're gonna say, in the essential workers category, grocery stores, gas stations,
Road
propane, county roads,
Yes,
that kind of stuff. Is that, we're gonna see something like that? Is that what
Yes.
you're getting?
Yeah, and that's still being worked. I mean, it's still fluid, so it's come as you are.
Okay,
Anyway, then eventually we will get into our elderly population. Those are high risk from pneumonia or asthmatic or whatever predisposing conditions they have, cardiovascular disease. So that is kind of the distribution list, and I can get you something formal when I have.
When you get
something
it.
Formal.
schedule wise, have you got enough, what their plan might be
Well,
yet?
Yeah, they're trying to send out enough to get to touch a certain number of people in the community, and that's parceled out by population.
Okay.
Yes, sir.
Dr. Brown, I haven't really heard this and I pay attention, but once someone gets the immunization, and I'm sure it takes a little while, kind of like the flu immunization to build up the antibodies and stuff. But what does that mean? Does that mean that you're safe from catching it? Does it mean that you won't expose other people? What does it mean once you get the vaccine?
Okay.
And I know it's a 2-dose process.
Yes. Basically, it cuts your chances of responding in a negative manner, being overwhelmed by the virus way down. Okay, does it guarantee you?
Sure. Nothing.
Well, but the effectivity rate they're broadcasting.
Yeah, the effectivity
95
rate
cents
is,
or
is essentially,
Right.
is almost 100%. So it's very good if things turn out to be what they're broadcasting.
So they're hoping. Yeah.
Yeah, what they found in their studies.
Right.
So it takes you from good chances down to very, very limited chances. So if you are at risk or dealing with these virus particles all the time, you have a very good chance of not getting sick.
I mean, Pfizer's claiming 95% effectiveness to prevent contracting the disease.
That's what I'm hearing.
Yes. And so is the other company. So they're,
I would rest a lot easier if Big Brother, the government said 95%. What do we expect from Pfizer? They're not going to say it's 40%.
Well,
They're trying to sell 800 million doses.
well, that's sort of maybe, but in order to be certified, they better not be lying
Well,
or
yeah.
advertising, because that's part of I mean, even the government could do that.
and the FDA is the one who is actually measuring and turning it loose.
I think they verified it was 95 is what I heard.
That's what it should be.
And it could be as early as
Yeah.
tomorrow they meet, so they may approve it tomorrow.
Yeah.
The Pfizer one.
That's what I
The
heard.
point is the fallacy of letting Pfizer conduct the trials and then give us the numbers.
Isn't that the way it always
I'm
works?
sure they're not.
But they're not doing it by,
They're not biased at all, right? Right.
of course, yeah, the elections show that.
I have a question to you, if I may, sir.
Go ahead.
Are we as a county going to prioritize our distribution, or are we going to follow what the state says?
Well, when they're handing out the candy we probably will be following what they say so that we get the rest of it. In other words, we get it as quickly as we possibly can, as much as we possibly can, so we can do as many people as we possibly can.
And you think we're gonna have to pay for these vaccines?
No, sir. Not, not right now.
They said they're not.
And then the information you relayed to us is some of that from your briefing this morning.
Yes, sir.
Maybe we're gonna get to that separately,
Yes.
but that's.
Okay, so let me tag on what you just said. One thing, Tom, is I think, but he raised a good point. I think if we had a special case, we can always make a special case to give somebody a shot
Yes, sir.
and save their life
Yes, sir.
or whatever.
Absolutely. Yeah,
And
that
not,
becomes.
not risk not getting any more cancer.
We also have injections.
We know what's on the ground. The state guideline maybe.
Right.
Broad.
It's modifiable.
Okay.
But we also have injections now that's injections that you get in the hospital
Sure.
to cut in half, essentially. They're actually working quite well to cut down the possibility of
Right.
serious
Okay.
problems.
One more quick follow-up on the vaccination thing. One thing leads to another here when I'm trying.
That's why discussion's good. We got, it's okay.
We're
It's okay.
way too early about worrying about who's gonna get the vaccine in our county, but at some point, I think we do want to be ahead of the curve.
Right.
And not be reactive. I just think we're way proactive yet, but based on your meetings and your briefing today, who's gonna give these vaccinations? Is the state gonna come do that at the county level?
No, sir. No, we are going through and we have been certified. Our people in public health have been certified now to give the vaccination. So no, we're not depending on somebody to come down in a team, because right now.
And right now,
we don't have enough team members.
And we don't need any special freezers.
No, we are not, we're not signed up for 70 below.
I'll be very pleasantly, of course, surprised if we're vaccinating a year from now. Maybe fall, but everything I read and hear, which we all know we shouldn't take anything to heart what we hear, right? I don't know. We'll see.
Yeah.
We'll see.
All right.
Yes, sir.
Okay, more.
In a study that was done here just recently, this is one of the challenges that we have for communication with our residents. 76% of the men and 57% of the women were positive toward receiving the vaccines. So there is some hesitation within our populations in general, and they're probably at least
Across the whole US you're talking about now.
Yes, sir. So I expect that the hesitation rate here will be at least equal to that.
It might be more than that.
You know, and that all boils back to that whole mistrust thing.
That's
Nobody
exactly
knew how
it.
to handle it. No two people can give the same answer. I mean, no wonder.
Even the normal flu has that issue.
Yes, sir.
People not wanting a shot.
In fact, going into that particular thing, the cons, the reason they gave that they did not want to do it was insufficient testing. That was number one. So this trust thing is big issue. And then the side effects from the vaccine, people are concerned about, and then the long-term effects of being vaccinated, and then politics, and then saying, well, this was too rushed, it couldn't possibly be valid. And then vaccinations in general, just people having hesitation, just not wanting to go there. So those are the big ones. Yes, sir.
One more is the chip that they're putting in there to follow people wherever they go.
Yeah,
And I
that's,
say that tongue in cheek, but I've heard it numerous
Still.
times
oh, yes.
from people,
That's actually a different program, but yes.
which of course we don't believe. I mean, I just want to say that publicly.
Gotcha.
Just because people say it doesn't mean I don't know where they get it.
There is a program being advocated by the state and by the federal government that involves a tracking device with your phones,
Through your phone.
through your phone, not a chip in your head.
That's a voluntary.
Yes, that is right now. It is.
One more quick question.
Go ahead.
If I may, and then I'll take a break. Any discussion in your circles about making it mandatory that children be vaccinated against COVID before they can go to school once the vaccination
I have
is
not,
available?
I've not seen that up in the States, sir. No, maybe I missed it, but
Yeah, I haven't heard it either. I just wondered.
yeah,
I wouldn't be surprised if they go that route, but of course, these people who anti-vaccination for whatever reasons they come up with to get around those laws. I mean, mumps, rubella, measles, that's a law. You have to be vaccinated
smallpox,
against smallpox to get into a public school.
yes.
I could see the government saying the same thing with this COVID.
It could happen. In a matter of fact, we had a sort of an insurgence of mumps that have been coming back because people have been too lax.
And measles the same way.
Measles.
In fact, back in 2010 and 11 and 12, when I was in DC, we were tracking just exactly that, breakouts. The half, and just to kind of help understand what we're up against here, half of those men and women who said, yes, I want to have it, half of them said, well, I'd like to have it immediately and as soon as I can get it. And the others broke down and, well, I'd like to wait for
See how many
a while
drop
and see how
over
many
before.
don't make it. Yeah, exactly. So even out of the 76 in the men and the 52 or whatever, 57 in the women, you got to divide that in half. So, yes. So there, we're going to be several months. And so for all the people who are interested in phoning in and asking, can I get it? Can I sign up? Whatever. You're looking at, I think, Tom, you're fairly well. I think it's going to be summertime.
Yeah, I was going to ask you think summertime, early fall?
So along that line, you can't skip counties and go get it quicker in Denver because you're going to be listed on a county registry.
Yes, sir.
So you will probably be vaccinated based on your residency.
Right.
Yes, sir.
Well,
That's why they've allotted certain things. And so it's not going to, in the next 6 months, save our restaurants, save our businesses, save our schools, which is, I think, the thought process.
If it goes out of hand.
That's right, exactly. So the vaccine is not available in that quantity to allow us, even if everybody took it. To
Not enough
handle the
numbers,
problems.
yeah.
That's right, exactly. So there is going to be, just to let you guys know, a tabletop exercise done on the 15th, which is just next Tuesday.
Right.
To kind of work through and decide, okay, what are we going to put in as far as our sequential level of importance? You know, who are we going to say as a county, these are number 1, 2, 3, 4, and down the list.
Who's gonna lead that for us?
Our 2 public health nurses and the people who are in tracking, tracing, you know. In other words, this gentleman sitting right over here, Mr. Washington, he is very intimately involved in getting these things designed and rolled out. So we should have some more information as far as our organizational scheme for its administration.
So are you talking about the priority of vaccinations or?
Yes, sir.
Yeah.
In our county, yes.
Because I thought I just asked, are we going to determine that or is the state going to?
We are going to have some input.
Okay, all right.
Okay.
So this is a,
This is a dry
we
run.
need to give input to the state to say this is how
Yes, sir.
our county believes
Yes, sir.
we should.
So it's better to have a mistake made on a dry run where you're not involving actual people so that you get the right,
Yes, sir.
okay, and the process where you may not get people in time. They're jamming up at the door and you got a stage.
And
Amazing.
angry and so on. Yes, expecting things that they can't have.
Okay.
So anyway, yes, you always, in the military and any large organization, you run through these things, preparing yourselves, and this is the expert over here, but you don't wait until.
That's a drip under pressure.
Oh, yes, an expert, yeah, is a has-been, and a spurt is an overgrown drip. Yes, sir. That's the way it is. Okay, so that's on Tuesday, and that'll happen at about 1 o'clock in the afternoon. Notice I didn't say $1,300, Tom. Sorry.
I would almost bet you wouldn't be having it at 1 o'clock in the morning.
No, hopefully not. Okay, but that's probably when things will go down.
Okay.
Anyway, those are are there other things that you would like me to touch on? I tried to kind of be as complete as what we know, because it's changing from day to day.
Sure.
I'm assuming you'll convey to us the outcome of that tabletop. So
Yes, sir.
we have some idea of what everybody's thinking.
Yes, sir. Absolutely.
Okay. Adrian, you got any input?
No, I'm good.
Clint?
Very beneficial.
Yep.
So
Okay.
I wish I could give you better news or positives and so on, but I'm literally giving you what I see. I'm afraid that there are still enough people not really taking things seriously. It'll never happen to me, you know, the 19-year-old mentality.
If I may,
Go ahead.
just before we broke for our BOCC meeting this morning, Clint read something about there's going to be money available to businesses provided there's enforcement of the masking rules. Did I understand that correctly, Clint?
Yeah, I'm not sure if the governor has signed it yet, but that's it. I already saw some feedback from county attorneys saying their commissioners aren't interested because it's not enough money to really, compel a business to, they're the ones that are violating it now are making more money than they would be if they followed the statute.
I get it.
And there is that dichotomy because we do have people, obviously, who will not walk into a business if they don't see a situation that would say, I'll be safe. There are other people who won't walk into the business if somebody is trying to be safe. So
Right.
there is a program, and this is the last item on my particular agenda. There is a program that ends tomorrow, and I have gained a little bit of leeway. They promised me that they'd give me a few more days, but restaurants, businesses receiving, it's a matter of, I think, around $3,500 if we go red, to buy us out kind of thing and say this is red, so these are definitely trying
That's a
times.
proposed program.
Right, but it only lasts essentially within a month or so, and then you have nothing. So we have then turned red and we don't have as many people coming in.
Sort of,
Yeah, and that's why I put it last, because I couldn't give her a definitive answer because I don't feel that it gives them enough. And I think this ties into what you just said. I don't think that it gives them enough to make it worthwhile for all the costs that it will levy against our county. So I told her I had kind of bargained with you guys to let me see what happens today, tomorrow, and the next day, and then she'll give us a little bit of leeway.
she understands it's
Yes,
kind
sir.
of specific.
Yes, sir.
We talk about L or?
Yeah, Michelle, so L, yeah,
L is how she goes.
right.
Yeah, I had a phone call in tomorrow last week too, and I never did hear back from her. Left a message on the voice.
She's still involved heavy. I thought she.
Oh, yeah. I was just gonna say, I can't imagine her giving phone calls, returning phone calls this time. It was just so crazy.
Okay. Anything else, guys?
Questions, gentlemen?
Well, I think that was we spent an hour. That was a very good hour. So thanks.
So we're scheduled again for
Friday at 11.
11.
Yeah, 11.
Good.
All right, I hear a motion to adjourn.
So moved.
Second.
Yeah.
For adjourn.